POV, when you want to satisfy your partner. Say goodbye to the problem of erectile dysfunction with Eric Prime. This natural supplement will give you the stamina and confidence you need to last through any sexual act. It's the perfect solution for both you and your partner. Get yours today and experience the difference.
Have you ever heard of death grip syndrome? Quite a name, isn't it? This may sound like something out of a science fiction novel, but it's a real condition that's often overlooked. An enigma that's not commonly discussed, yet holds a crucial role in understanding one's physical and mental well-being. It's time we break the silence, burst the bubble of misunderstanding, and shed light on death grip syndrome. So buckle up as we're about to embark on a journey of discovery. Stay tuned as we delve into this intriguing and important topic. Death grip syndrome is not as ominous as it sounds, but it's certainly a condition worth understanding. It's a term that's been coined in recent years, and it describes a situation where a person, usually a man, has become so accustomed to the pressure and intensity of their own hand during self-stimulation that they find it difficult to reach climax through other means, such as sexual intercourse or oral stimulation. This condition isn't officially recognized in medical manuals, but it's a real issue that can affect one's sexual performance and overall satisfaction. It's important to note that death grip syndrome isn't about how often one engages in self-stimulation, but rather, it's about the method. It's called death grip because it's often the result of applying too much pressure during self-stimulation, leading to a decrease in sensitivity. Let's break it down a little further. The human body is a fascinating machine, capable of adapting to an array of different conditions. When a particular action or behavior is repeated over and over again, the body learns to anticipate and respond to it. This is known as conditioning. So if a person repeatedly applies a high level of pressure during self-stimulation, over time, their body becomes conditioned to that level of intensity. As a result, other forms of stimulation may not provide the same level of satisfaction, leading to difficulties during sexual encounters. Although this syndrome may sound daunting, it's crucial to remember that it's not a life sentence. It's a condition that can be reversed with time, patience, and a change in habits. The key is to recognize the issue and take steps towards a solution, and there you have it. Death grip syndrome is a condition that arises from the body's natural ability to adapt and condition itself to repeated behaviors. It's an issue that primarily affects sexual performance, but with awareness and understanding, it's something that can be managed and overcome. Now that we know what death grip syndrome is, let's explore what causes it. What leads someone to develop death grip syndrome? A question many of you might have pondered upon. The answer, in short, is frequent and aggressive masturbation. But let's delve deeper into the nuances of this cause. One of the primary reasons behind the development of death grip syndrome, or DGS, as it's sometimes referred to, is the habitual and intense pressure applied during masturbation. This is often done in an attempt to achieve a higher level of sexual gratification. However, this high-intensity stimulation can lead to a reduction in sensitivity over time. In other words, the body becomes accustomed to such extreme levels of stimulation that anything less intense can seem insufficient. Another contributing factor is the frequency of masturbation. If you're frequently engaging in the act, especially with a tight grip or intense pressure, you're continually exerting stress on the penile tissues. This constant strain can lead to the desensitization of the penis, making it harder to achieve an orgasm under less intense stimulation, such as during sexual intercourse. Additionally, the use of certain sexual practices or aids can also lead to the development of DGS. For instance, the use of certain types of sex toys that provide high-intensity stimulation can condition the body to anticipate and require such levels of stimulation, thereby contributing to the onset of this syndrome. Furthermore, psychological factors also play a significant role. The mind's perception of what constitutes normal stimulation can be skewed due to frequent and intense masturbation. This altered perception can result in the need for more intense stimulation to reach orgasm, thus perpetuating the cycle of death grip syndrome. The causes of death grip syndrome are both physical and psychological, and the impact can be significant. It's essential to recognize these causes to understand the syndrome better and take steps towards its prevention or treatment. Remember, your sexual health is a critical aspect of your overall well-being, and understanding these causes is a step towards preserving it. The symptoms of death grip syndrome can be quite telling. Let's find out what they are. How do you know if you or someone you know is suffering from death grip syndrome? Well, like many medical conditions, death grip syndrome often presents itself through a series of noticeable symptoms. The most common of these symptoms is a decreased sensitivity in the penis. This occurs when the penis becomes desensitized due to the intense pressure and friction applied during masturbation. Over time, the penis becomes conditioned to this high level of stimulation, and as a result, less sensitive to other forms of touch. This decreased sensitivity can gradually lead to another common symptom of death grip syndrome: difficulty achieving orgasm, especially during sexual intercourse. Because the penis has become accustomed to such a high level of stimulation, it may become challenging to reach orgasm through less intense forms of stimulation, such as vaginal penetration. In some cases, individuals may even find it impossible to orgasm without the intense pressure they're used to applying. Another symptom that may indicate the presence of death grip syndrome is the need for increasingly intense stimulation to achieve orgasm. As the penis becomes more and more desensitized, the level of stimulation required to reach orgasm can escalate, leading to a vicious cycle of even more intense pressure and further decreased sensitivity. It's also worth noting that death grip syndrome can have psychological symptoms as well as physical ones. Many individuals with this condition experience feelings of frustration and embarrassment due to their sexual difficulties. These feelings can, in turn, lead to performance anxiety and further exacerbate the problem. However, it's important to remember that experiencing one or more of these symptoms does not necessarily mean you have death grip syndrome. These symptoms can also be caused by a variety of other medical conditions, so it's always best to consult with a healthcare professional if you're experiencing any sexual difficulties. Understanding the symptoms is the first step towards addressing the issue, but what can one do to treat this condition? Facing death grip syndrome might seem daunting, but there are ways to overcome it. Treatment primarily revolves around behavioral changes and therapeutic interventions, and today, we're going to discuss both. First, let's talk about behavioral changes. The key to treating death grip syndrome is to break the cycle of intense stimulation that has conditioned the body to respond only to a certain kind of touch. This involves practicing a more gentle touch during self-stimulation or intercourse. One popular method is the start-stop technique. This involves arousing oneself to the point of climax, but stopping before reaching it, allowing the arousal to subside, and then starting again. This technique can help retrain the body's response to gentler forms of stimulation. Another behavioral method is to abstain from self-stimulation for a period of time. This is often referred to as rebooting. The length of this period varies, but it often lasts a few weeks. This break can help reset the body's responses to a more normal level of stimulation. Therapeutic interventions are also an important part of treatment. This can involve working with a therapist or counselor who specializes in sexual health. They can provide guidance and strategies for changing behaviors and overcoming the psychological aspects of death grip syndrome. It's important to remember that there's no shame in seeking professional help. In fact, it's a very brave and crucial step towards recovery. Lastly, using a specially designed sex toy or device can also help in retraining the body's response to different kinds of stimulation. These devices often simulate a more realistic experience and can help in transitioning from a death grip to a gentler touch. These treatment options can be combined and tailored to suit each individual's needs. It's a journey, not a sprint, and it's important to be patient with oneself during this process. The key is to remain consistent and committed to the treatment plan. Remember, seeking help is the first step towards recovery. Embrace this journey with an open mind and remember that it's okay to reach out for help when you need it. Death grip syndrome is a condition that needs more awareness and understanding. We've unpacked its definition, causes, symptoms, and treatments. It's crucial to have open conversations about such topics, breaking down barriers of silence and shame. We believe that by shedding light on issues like these, we can foster an environment of acceptance and proactive health management. If you found this video informative, please like, comment, and subscribe for more such content. Remember, knowledge is the first step towards change.